My voice is a little strange, so if I start coughing in the middle, do not worry, I am not going to die. Just sit there until I'm through. Hopefully I won't. Well, what I wanted to do, in order to reflect on some of the themes in Living at the Boundary, is to talk about the distinction between healing and curing disease, and look at some of the ways in which healing can be promoted that I have talked about some in the book. I just want to put that a little more. You know, and healing, of course, means restoring and preserving a sense of personal integrity and wholeness, even in the face of illness. So as I say in Living at the Boundary, you can be cured and not healed. And the example I gave was the woman who'd had a radical mastectomy but who still suffered because of the change in her body. And you can be healed and not cured, as in the case with someone with terminal or serious illness where illness cannot be cured. And so, you know, you might be saying, well, why is it important to even think about healing? Because my goal is to cure my patients of their diseases. And the problem with that is that the majority of patients who seek medical care are patients with incurable illness, chronic and incurable illness. And if cure is your only goal, then you're not going to be able to meet that goal in your professional practice, and you're certainly not going to be able to meet it in all of your patients, even in the event that you deal with people who have acute illnesses. So it's very important to think about what it means to be a healer, because no matter what the situation is, we can always be healers, because we can always assist in helping a person to preserve their sense of personal wholeness. You know, we have to think too about the difference between physical and personal wholeness. And we talked about it once in terms of disability. I think I said to you, you know, I would score high on the Kurtzke disability scale, which would refer to my physical function, but on the scale of, by scoring high on that scale, it would mean that I had serious disability. But in terms of what I consider to be personal wholeness, in terms of my life and the meaning that I have in my life, that scoring high on the disability scale does not correlate with the sense of personal wholeness, and the sense of personal wholeness is the thing that's most important. Now, in Living at the Boundary, I talked about a cancer study in which the majority of patients considered themselves to be healthy, even though they were dying. And when you read the study, you see very clearly that these patients were not in denial. They knew they were dying, but they felt healthy in the sense that their lives had meaning for them, and they felt a sense of personal integrity. And they equated health with the absence of suffering. Now, another thing that we have to recognize is that suffering is not the same thing as physical pain. That people can have physical pain and not suffer, and people can suffer who don't have physical pain. It has to do with the personal meaning that the illness has in the context of a particular life. And I know all semester you've been recognizing how important it is to understand the illness in the context of a particular life. So what they found in that study that was interesting was that healing was very much related to a sense of connectedness. Connectedness with others, connectedness with self, connectedness with God, a sense of meaning in the context of suffering, an ability to accept and find peace in the present moment, and an ability to choose one's attitude in the face of loss of control. Whereas suffering, on the other hand, was related to a sense of disconnection from others, disconnection from self, disconnection from ultimate meaning, disconnection from the phenomenal world, a preoccupation with the future or the past, and an inability to find peace or acceptance in the present, a sense of victimization, and a need to be in control. And if you think a little bit about those themes, particularly with relationship to the disconnectedness between self and world, you know, it relates very much to what we've been talking about in the change in the ability to get around the world, change in the way we think about our bodies, the change in our lives in terms of what illness does. And so it's kind of interesting to think about that in terms of the disconnection from others. And so I'm going to try and make some connections here between this connectedness and disconnection and what I've shared in Living at the Boundary and what you've been talking about all semester. So what is it about sickness that causes disconnection from others? Well, first it has to do with cultural attitudes towards sickness, disability, and dying. Those with incurable disability and those who are terminally ill are often marginalized and set apart from others. And so why do we have these attitudes about illness and dying? And for the most part, we don't accept that there are certain givens in our life and that suffering, illness, and dying are a part of life. And there, you know, we've talked about cultural attitudes, the many reasons for that. We have very unrealistic ideals about health, beauty, youth, and the human capacity to control and so forth. And the context of modern medicine, which has given us an illusion that all disease can be cured. And so we have an ultimate faith in medicine. Of course, with the advent of AIDS and the prevalence of cancer and the infections now that are resistant to antibiotics, maybe our faith in medicine is a little shaken. But for the most part, people have incredible faith in the power of medicine. And so, a diagnosis of incurable illness has symbolic meanings, as I talk about. You know, a diagnosis of cancer, diagnosis of MS carry with them particular meanings, so that the study with MS patients in Ontario showed that simply receiving the diagnosis was equivalent to moderate disability, regardless of what was going on with their bodies. And as Arthur Frank talks about, people reacted very differently to him when he had a heart attack than they did when he was diagnosed with cancer. And the diagnosis of cancer caused people to withdraw. And so the disconnectedness begins with people withdrawing from the person who is ill and them feeling totally isolated. So healing is very much related to preserving a sense of connection and connectedness. And I think you could see in Living at the Boundary, when I talked about my husband's dying, when I talked about Dee's dying, he continued to be the center of a web of relationships. And so there was always this connectedness to other people in the community. You know, children would come over and bring him gifts, and young people would come and sing to him. People visited, sat with him, laughed with him, cried with him. The doctor in our community visited every day to spend time with him and pray with him, and he became one of our closest friends. And just recently here, he and his wife had a baby boy, and they called him Derek after my husband. So Dee lives on through him. So the thing is that it's very important to not let illness disconnect you from those who are sick or grieving. And as William Osler says, you know, the most important thing is to be there. Don't just do something, stand there. For people to feel that you are present with them in their illness. And another form of disconnection in the context of medicine that we've talked about is what I've called loss of voice, where the voice of medicine predominates and the patient is not allowed to tell you their story from their perspective in the context of their lives, because you're just focused on what the X-ray is saying, what the blood tests are doing. And if the patient can't tell you the story, they feel that they're alone in dealing with their distress. So remember, I told you that Richard Barron's paper was "I can't hear you while I'm listening." Well, it's important to listen as well as to hear and to see what is happening in terms of the physical state of the body. Now, Rachel Remen, I mean, what you can say is, well, and I understand this, well, how can I do that in 15 minutes? Well, I just want to read you something that Rachel Remen wrote. She suffered from Crohn's disease all her life, and she tells of a time when she experienced very serious and strange symptoms that numerous specialists could not explain. She says, over a period of several months, these symptoms grew more frequent and severe. I continued to visit my doctors regularly, more because I did not know what else to do than because I thought they could offer any explanation or help. Eventually, I stopped telling them some of the more unusual things that I was experiencing. I felt they no longer wanted to hear. As things became worse, I began to feel that something very dangerous was happening to me that no one could even name. In desperation, I made an appointment to see yet another doctor, a surgeon who had sat with me on the advisory board for a research project. Dr. Smith was the head of the Department of Surgery in a large HMO, a prepaid health plan whose protocol legislated the length of time that a doctor could spend with a patient during any single visit. We would have 15 minutes together. Sitting in his tiny examining room waiting, I regretted making this appointment. It would probably be a waste of time. What could this man possibly do to be of help in 15 minutes when several other physicians had not been able to offer much despite hours of their time? There was a soft knock on the door and Dr. Smith entered. He greeted me and then spent a few minutes sitting quietly and reading over the lab results and X-ray studies I brought with me. Then he leaned toward me and said, "Tell me why you have come." I looked into his face and saw a genuine concern. I began to tell him all the things I was experiencing, starting with the more commonplace and finally including such things as the strange taste that often awakened me from sleep and the times when I suddenly lost all sense of direction and was unable to remember how to get home. My voice shook a little. He continued to listen. It took no more than 9 or 10 minutes to tell my whole story. Dr. Smith said nothing to interrupt and just listened closely. When I had finished, he asked a few questions that showed me that he had heard and fully understood. Then he reached for my hand and told me that he realized how hard things were. He validated my concerns. Despite the strangeness of these happenings, this was not all in my head. There is no question that there is something going on that we do not yet understand, he told me. He reminded me that my lab studies had ruled out the truly life-threatening possibilities. He assured me that eventually whatever this was would declare itself more clearly, and when it did, if there was a surgical solution, he would be there. He looked at me and smiled. "We will wait together," he said. Like the others, he had no diagnosis. What he offered was his caring and companionship, his willingness to face the unknown with me. In 14 minutes, he had lifted the loneliness that had separated me from others and from my own strength. In some way that I didn't understand then, this made all the difference. Someone else knew, someone else cared, and because of this, I found I had the courage to deal with whatever was going to happen. Several months later, when the great abscess hidden deep in my abdomen finally appeared on an X-ray, it was he who did my surgery. So it is possible to do it in 15 minutes. I remember shadowing down at the family practice centre, and there was one young man down there, one of the family practice residents, and you could tell that he really had a healing connection with the patient. patients in a way that maybe some of the others didn't. But he didn't spend any longer with them. He just really paid attention to what they were saying. Now, the disconnectedness from self and others is also, as I've spoken about, caused by the emphasis on doing versus being. And so connectedness requires us to shift our perspective to recognize the value of being and the reciprocal nature of the caregiving relationship. In the Christian context, we believe that every person, no matter what their condition or station in life, has intrinsic worth. Every person is made in the image of God, not just the most successful, the most beautiful, the most physically healthy, the ones who have it all together, and so on, but every person. So every person has value by virtue of the fact that they are. In recognizing our worth is not calculated by what we can do, we see that the sick and the terminally ill have a lot to offer us. In the context of medicine, there's much they can teach us about the body, but also much they can teach us about our character. Do we have patience, love, commitment in the face of difficulty? My most precious gift was to be able to serve Dee after he had served me for the 31 years of our marriage, and I wouldn't take that gift away for anything. As health professionals, you're not the only one who is giving. The patient is trusting you with his or her care, is giving himself or herself into your hands, and in this sense, medicine is the most human of sciences. As one of the cancer patients in the research study said, it is important to remember that even if we are sick and have cancer, we are people. We are alive. We are not half-dead people who cannot do anything. We are capable of being creative. We can still love. The cultural notion that worth is to be equated with doing also causes disconnectedness from the self, in the sense that people define themselves by what they do. So when they can no longer do, there's something about, it's not just what am I doing, it's who am I now that I'm this person who is no longer doing. I think you see that a lot in professionals who retire, who, you know, all of a sudden they don't have their work, and they sometimes they just feel adrift because they say, who am I now? I'm no longer this person that I used to be. So it's very important that we reaffirm the value of being, and that we pay respect to every person and show them that they really are worth something, regardless of whether or not they can do. In the context of Christian community, I've talked about how we view disability differently. How, the scripture says we have this treasure in jars of clay to show that this all-surpassing power is from God and not from us. And so, in the context of the community where I live, I never really think of people as disabled. I just think of them in terms of the part that they play in the life of the community. And that is a very empowering thing for people with disabilities. In the context of the community, I no longer think of myself as being disabled. There are ways in which people can treat you which make you feel like you're disabled. So it's when you're thinking about connectedness and helping people to stay connected to one another, that's one of the things that you need to think about. Another thing is that with disability and illness, because we no longer accept the givens in our lives, it causes us to suffer when things come up that we're not part of our plan of life. Now, I think in the Christian perspective, we are called to surrender to the givens in our lives. And as I've spoken about before, we also see that God's perspective is very different from ours. And that in fact it can be an opportunity for all kinds of personal and spiritual growth, and an opportunity in many other ways. I've told you, of course, I think I told you last time I was here, that when I look back on my life, I can see that my life would have been entirely different if I'd not had a disability. I would not have done any of the work that I've done if I'd not had a disability. Well, somebody may say, well, you may have done something else really great. Well, maybe. But I can see how my illness has enabled me to live a very meaningful life. So illness becomes not just a negative, but an opportunity for us to say, not my will, but thine be done. And you know, the thing is, Dee and I had to pray that prayer, because we had to give up our idea that he was going to live forever, which he promised me he was going to do. But when we prayed that prayer, we really did feel the peace that is beyond all kind of understanding. You know, we felt the overcoming power of God and the peace that really is beyond understanding. The other thing is, of course, in speaking of his own incurable illness, Paul notes that God's power is made perfect in weakness, which is a completely countercultural idea. And that reason is because it's in weakness that we concretely feel our need for God, but we also feel our need for one another. Now, reinforcing the value of being through, I want to say, through healing communication, attentive listening, bearing witness to the other's pain. Such attention to the patient and the possibility of relieving suffering is possible even in the case of someone with Alzheimer's disease. I don't know if I told you this example before, but Rachel Remen talks about this woman who had Alzheimer's, and she was very agitated, distracted. She marched up and down, up and down, up and down, up and down all the time. And the staff in the nursing home didn't know what to do. They couldn't help her. They didn't know what to do about it. And so one day when she was marching up and down, she happened to catch sight of herself in the mirror. And she looked at this person in the mirror, and it was like she knew that this was somebody that she recognized, even though she wasn't sure who it was. And she began talking to this person in the mirror in a completely ununderstandable, incomprehensible language. And from that, and then she became very calm. And from that day on, she would stand in front of the mirror and talk to herself, to her reflection in the mirror all day long. Well, the staff were kind of delighted about this because she was no longer agitated and they didn't pay any attention to her. But then one doctor saw her, and he went and he stood by her and he started talking to the person in the mirror. And he was very moved to see that as he was doing that, the lady with Alzheimer's had tears in her eyes and started crying, you know. So he was making a connection with her that was not, you know, you might think it's not possible, but he was able to connect with her. We've had people with Alzheimer's in our community, parents of people who live in our community, and we brought them into the community, and we have found in a couple of cases these were people who had been in nursing homes and were very agitated and distressed in the nursing homes. And once they got into the context of a family and people who were with them all the time, it really did make a difference. Even though they didn't necessarily know who was there, they felt something, you know. So it is possible to reach even someone with Alzheimer's. John Swinton spoke here at a conference on human dignity in healthcare, and he's worked with Alzheimer's patients. He's at a university in Scotland, and he tells of a patient who was very anxious and who walked around all the time saying, God, God, God. And the nurse said to her, are you afraid you're going to forget God? And she said, yes, she was afraid she was going to forget God. So the nurse told her, well, God is not going to forgive me. And once she realized that God was not going to forgive her, then she was much less agitated. And speaking of patients who lose their memory and thus feel, and we feel, they have lost themselves, Swinton said, we are complete in the memory of God. Compassion, we want to talk about compassion and connectedness. Compassion has to do with being with the person, expressing solidarity with the person. And, in here I talk about when Dee was diagnosed, I wrote in my journal, we're in the Garden of Gethsemane, and how my biggest fear was that I would not be able to stand with him in his pain and suffering. And then someone said to me, we will stand with you. And the difference that made, that enabled me to be with Dee during this whole experience. Just the thought that there was another person who was standing with me. So being with a person and expressing solidarity with them is an incredibly powerful way to help them to feel connection. Okay, one of the things that the people who were suffering in the study talked about how disconnectedness was connected to loss of control, and we talked about loss of control. And the problem with loss of control is that very often, as it did in this case, it can lead to a sense of victimization. And when a person feels a sense of victimization, they really are not able to move in a positive way. And I know that for myself, because when I was diagnosed with MS, my first thought initially was, well, why me? Then almost immediately I thought, well, why not? Why should I, of all people, be spared and other people not? And the minute I recognized that why not, it was this incredibly freeing thought. Because I didn't feel like I was a victim. I didn't feel like God had picked me out for a particular reason. I didn't feel like this was so unjust to be else. I don't know. And so it enabled me to recognize that I could choose how to respond to this situation. And, at the time I had read Viktor Frankl, and he says, Frankl was in a concentration camp. He lost all his family in a concentration camp. And he talked about how there were some people in the camp who would steal your last piece of bread. There were other people in the camp who would give you their last piece of bread. And that the people in the camp who chose to help other people were the people who survived the longest. And he says that everything can be taken away, but the last of human freedoms, the freedom to choose how to react to any given set of circumstances. And the people who felt a sense of wholeness were able to find a sense of peace in their current circumstances. The people who did not feel a sense of wholeness, many of them were trapped either in the past or in the future. And serious illness causes a change in the perspective in time. Sometimes, with an illness like MS that is a progressive illness, you can become so preoccupied with what may happen in the future that you're literally paralyzed in the present. Or you can be so preoccupied with how you used to be in the past, and you're no longer able to be, that you can't live in the present. So living in the present is a very important thing. And it's something that you may have to train yourself to do. When I was diagnosed with MS, having seen that terrible movie that I think I told you about, I lived in fear for a couple of years before I began to realize that I had to bring my attention back to the present. So rather than determining whether or not I would ever get a degree, I focused on getting through this particular semester and getting the most I could out of this particular course. And like I told you, I've got my PhD at Rice 1 week at a time, so if you do it 1 week at a time. So there is an incredible power to letting go. And the thing about embracing our own vulnerability is that it opens us up to relationship with others. Once we recognize our vulnerability, we recognize our need for other people. And that gives us an opportunity to form bonds with others that we might not necessarily have formed. And, you know, the bonds that I've forged with those who came to care for my husband in a multitude of ways, in his extreme vulnerability, are bonds of love that will never be broken. When you go, I'm sure some of you have been through difficult times with people, and you know going through those times are times that really bind you together. And when you work with people who are going through difficult times, as you will if you're a healthcare professional, that gives you an opportunity to be an influence for good, an influence for healing in their lives. Recognizing that we're not in control of our lives also many times strengthens our connectedness to God. We have to reach out to God in those extreme situations, and He gives us grace that we never could have imagined we could have. Many of the cancer patients talked about how their illness had brought them closer to God, and all talk about how their illness caused them to reevaluate what was most meaningful in their lives. You know, a diagnosis of serious illness causes you to ask, what is the most important thing in my life? It's probably the most important thing is not going to the shopping mall and buying 65 dresses or something, you know. The word grace, I want to talk about grace. The word grace is connected to the word gratitude. And, you know, I've found that reaching out to others provides us with grace. We feel the grace of God where through those people who come to us and help us. And receiving grace, receiving this grace from others causes us to feel an extreme sense of gratitude for all that's been given to us. And you know, when we serve other people, we can also experience grace in the gratitude that we have for being able to be in this relationship with this person at this difficult point in their lives. Gives us an opportunity to do something for good. We're always grateful if we can be in an opportunity, have an opportunity to help somebody. Now, of course, embracing vulnerability, when I talk about the healing context of Christian community, the foundation stone of our Christian lives is self-sacrificial love, laying down our lives for one another. And in this sense, medicine and caregiving is a servant profession. David Hilfiker, who worked with the poor in Washington, did poverty medicine in Washington, came and spoke here one year. And he said that he would go out and he would speak to medical students, and he was astonished at how few of them thought of medicine as a servant profession. But I hope, you know, that we think of it as a servant profession, as an opportunity to serve others. Time for tea. Now, you know, the people who felt a sense of wholeness had a sense of meaning in their lives. And of course, for Christians, the narrative of our lives takes place within the larger narrative of love overcoming the power of death. And that gives a whole new meaning to living and dying and suffering so for D&I, his death was not meaningless. God knows the end from the beginning. It wasn't that it was not easy to lose him, but it was not meaningless. And as he was dying, he told me, this is not the end, it's a new beginning. And the thing was that how God gives incredible grace. The night that he died, I was alone after he died. I mean, I wasn't alone in the house, I was alone in the room where he died. And all I could hear all night long, I stayed awake all night long, was Regina Titley, who is someone who sings in our church and who often came to sing the D, singing that song, I Know My Redeemer Lives. And you know, I just felt a victory in it, and it took away the sense of meaninglessness that some people have about dying. We had a conference, in the conference we had at Baylor on human dignity and health care. A Christian theologian came and he spoke about how if Christians really believed what they say they believe about dying, their attitudes towards healthcare would be entirely different. Their attitudes towards dying would be entirely different. So the question is, you know, at that time, we know whether we believe it or not. So I just want to have time for you to ask questions and things. So I'm going to pretty much end, but I want to just say that never forget, as impressive as the discoveries of modern medicine are, we need to recognize that we are not God, and there is much that we cannot understand from our limited human perspective, and this should cause us always to feel a sense of awe in the midst of the busyness of our lives. And so I'm going to give you another story from Rachel Wren. Recently, during a physician's seminar on listening, we all took out our stethoscopes and spent several minutes listening to our own hearts. We are all middle-aged people, and for the first little while, everyone anxiously diagnosed themselves, fearful of hearing a third heart sound or perhaps the murmur of an arteriosclerotic valve. But as time went on, we moved past all that and heard something steadfast in the midst of our lives that had been there always, even before we were fully human. Our lives and all other lives depended on it. It was a profound and ineffable encounter with the mysterious. Most of us were deeply moved. We had listened to and diagnosed hearts for years, but none of us had ever experienced this before. In that moment, we had glimpsed something beyond our habitual way of seeing and hearing, and knew that what we work with every day is life itself. Afterward, there was a silence. Then one of the cardiologists present began to speak about his work and to wonder aloud how one could be so close to something holy and not know it. It reminded him, he said, of a prayer that he had heard some time back. Somewhat embarrassed, he began to recite it aloud. Days pass and the years vanish, and we walk sightless among miracles. Lord, fill our eyes with seeing and our minds with knowing. Let there be moments when your presence like lightning illumines the darkness in which we walk. Help us to see wherever we gaze that the bush burns unconsumed. And we, clay touched by God, will reach out for holiness and exclaim in wonder, how filled with awe is this place, and we did not know it. And then one last story, because I want to always leave you with the idea that medicine is a reciprocal relationship, that you and the patient are partners. She's got this little story called Healing is Mutual. Frank is a middle-aged internist, the director of one of the medical clinics at a Midwestern inner-city hospital. For some time now, he has secretly thought about leaving medicine for something else, something more satisfying. Someone suggested that he try a physician's training program I teach before he made any big choices, and for the past 9 months he has been redefined in his work. He tells this story about returning to his clinic after a weekend workshop on the power of intuition. His clinic is at a large teaching hospital. As faculty, part of his job is to see those patients who have no teaching value. Those who present a medical challenge or a diagnostic problem are saved for the younger doctors who are still in training. On this particular Monday afternoon, one of these patients, Mrs. Gonzalez, was his regular 2 o'clock appointment. She was an elderly lady, maybe 80, in the last stages of breast cancer. No further cancer treatment was available for her, so at each visit he would listen to how her week went, adjust her pain medications, and treat any other complaints she had as best he could. On this Monday, as always, he made adjustments in her palliative regime, and then, thinking of the weekend, he decided to take a few moments to reflect and see what his intuition had to say about her. Much to his surprise, his intuition suggested that what would be most helpful to Mrs. Gonzalez now would be for them to pray together. He was not a praying man, and he began to sweat. Professionally, that felt risky to him. He reviewed the danger checklist from the workshop in his mind. Was there some reason not to do this? Would following his intuitive insight cause anyone harm? Would it delay or negate some needed treatment? Would it embarrass or humiliate anyone? Going down the list, he could not find a good reason to discard his insight, so there it was. So Frank turned to this ill grandmotherly patient and said, "Mrs. Gonzalez, perhaps it might be good if we prayed together." She looked at him and began to cry. Fortunately, he didn't do what I had been trained to do years ago when a patient cries. He didn't call a nurse. He did what he had learned to do in another of the training workshops. Taking her hand, he simply received her emotions respectfully and waited. Still holding his hand, she said, "That would be very wonderful, doctor." Then she told him that she was a Catholic and asked him if they could kneel down. Shaken, he looked toward the door. It was closed. He was on highly unfamiliar ground, but he was in it already, and he decided to continue. "Certainly," he replied. So in his white coat, he helped her to kneel down, and he knelt down with her in the tiny examining room. She began to pray, first in Spanish and then in English. He had not prayed for many years, but a calm settled over him, and his memory, awakened by the sound of her voice, gave him back a prayer from his childhood. When she had finished, he said it aloud. There was a long, comfortable silence. Then very gently the old woman reached across and touched his cheek. First in Spanish and then in English, she asked God to bless him and strengthen him in doing his important work. He says he can still feel the touch of her hand even 6 months later. He remembers it when things get tough, and it helps him. He often prays with his patients now, both for them and for himself. One of the reasons that many physicians feel drained by their work is that they do not know how to make an opening to receive anything from their patients. The way we were trained, receiving is considered unprofessional. The way most of us were raised, receiving is considered